Hello, everyone, and welcome to our last session of Day 3 of Kidney Action Week 2026. My name is Lauren Andracchio. I'm the Director of Curriculum Development at the American Kidney Fund, and I'll be your moderator for this next session entitled Get Your Transplant Questions Answered, Q&A with the Transplant Professional. If you attended our last two sessions, you had the opportunity to learn about the process and expectations of both pre- and post-transplant living. Now, in this session, you'll have the chance to get any of your unanswered transplant questions answered by a transplant professional. Before we get started, I wanted to share a disclaimer. The information shared in this live Q&A is for educational purposes only and isn't intended as medical advice. Please consult your healthcare provider for guidance on your personal health, and in case of an emergency, please seek immediate attention. Now, I'd like to introduce our panelists who will be answering our questions today. Shazia Lakhani. Shazia is the Senior Director of Clinical Education at the American Kidney Fund and a nurse practitioner in transplant surgery in Washington, D.C., with over 14 years of experience managing kidney disease and transplants. Prior to AKF, she was the lead nurse practitioner at Georgetown University Hospital, supporting healthcare professionals and patients with clinical protocols and resources focusing on patient safety and innovation. She is passionate about educating others on the risks of kidney disease, learning about slowing the progression of the disease, promoting early detection, raising awareness about kidney replacement therapies. Welcome, Shazia.
Thank you.
All right, as we get started, please feel free to type your questions in the chat and we'll do our best to get to them. As you all are doing that, we do have some questions prepped to get us started and go over some basics. So we'll be doing a little bit of a recap from the past two sessions for those who were unable to attend. All right, Shazia, to get us started, can you talk to us about what a kidney transplant is? Thinking about it as a general treatment option, benefits and risks, and then talk through some of the different types of transplant, please.
Thank you. That's a great question to level set us and get us started. So, a kidney transplant is a treatment option for kidney failure. You've heard about it in the prior sessions, and it replaces a failed kidney or kidneys with a healthy one from a donor. And it's not a cure, but it dramatically can improve quality of life and survival. It entails a surgery, and there's two types of donors. So, you could have a living donor or a deceased donor. Both of these, as I'm sure we'll delve into, have to do with being listed for a kidney transplant and being worked up for evaluation to make sure that you're a suitable candidate. And so I just want to say that it's important to know that transplant offers a lot of good opportunities and quality of life. So I am really excited and look forward to discussing this further.
Wonderful. Thank you so much for getting us started with that foundation. We're going to shift gears and we're going to start thinking about someone who's considering transplant. So thinking about that evaluation process. And when can someone start thinking about talking to their doctor about a transplant?
Yeah, it's important to get started early. So if you haven't started dialysis yet and you've been told that you have kidney disease and are nearing kidney failure, or just that you have kidney disease, it's important to first know the cause and consider transplant as an option. It is an option as a replacement therapy, and it can be an option before dialysis is even started. So that's something called a preemptive kidney transplant. And that's around the time where your kidney function drops to about 20% or so. And the earlier you start the conversation, the more control you have, the more options you have. So that for you, it's not a last minute decision. I know for some, it is unfortunately a last minute decision because they may crash into dialysis, but still, you can still be evaluated for a kidney transplant.
Wonderful. Thank you. Okay. And you mentioned that a transplant is not a cure. So I kind of want to go back to that. Can you talk about, what happens if someone's in rejection, what the possibility is, and then talk a little bit about how to avoid that and talk about some of these anti-rejection medicines?
Yeah, that's a great question. So it doesn't last forever. And we talk about how long they last. So about, I would say, a deceased donor is about 10 to 15 years, living donor about 15 to 20 years. But it does take immunosuppressants. So immunosuppressants help this foreign organ that is now new to you, your body, to help adapt. And the immunosuppressants are taken for life. They protect the kidney, and your transplant team works with you the entire way through. And even if they hand you off to a general nephrologist, one that was working with you prior to the transplant team will help manage them, look at levels. and ensure that before you even get to that process, that you can manage that. So you're a good candidate through evaluation. They look at your overall health history and insurance so that you can make sure you're supported in all facets. Um, but the immunosuppression aspect is very important. So that's a good point you brought up.
Wonderful. Okay. And we're going to talk a little bit about pre-transplant here. So again, those of you who are attended our session a little bit earlier, we had two SMEs, subject matter experts that were talking about pre-transplant. We're going to go back into that a little bit. What factors are considered when someone is being evaluated for transplant, and what qualities make someone a good candidate?
So a good candidate would be, well, first, evaluation. So evaluation looks at overall health, that includes heart health, any cancer history, infection risk, and the ability to take your medications consistently. So is your insurance affected by it? How can they help you in that aspect? And a lot of the evaluation is also getting you ready for what to expect, even if you are not listed yet. So you know how to prepare. Um, I would say in terms of knowing in terms of who would be a good candidate, someone who, bringing your medication list to your appointment, ensuring that you have, um, the questions answered. Your evaluation requires CT scan and evaluation for surgery. When I mention heart health, I mean an EKG is done, an echocardiogram is done, and that your maintenance health history is also done. So your colonoscopy, if you're due, any mammogram, pap smear, prostate cancer screening, those are all very important. And those determine eligibility for transplant.
Okay, wonderful. Um, Can you walk us through how long people can expect to wait on the wait list and what variables can impact someone's wait time?
Great question. So the wait time on average looks like a few years to about 5 years. So people may get listed and get wait list appointments every year, but essentially sometimes you won't get a call until you're near the top of the wait list. There's 100,000 people waiting for a kidney transplant. And so you may wind up waiting for a deceased donor organ for 5 years. Now, a living donor, you can find a match, maybe have a willing family member to be evaluated for a kidney transplant, and that is much faster. But it also depends on blood type. So B and O have a longer wait time for a deceased donor organ. But it also matters what the sensitization status is. So when I say that, I mean antibodies. And so if you've had multiple transfusions, multiple pregnancies, that can impact your antibody levels, which can impact your match. And it might be harder to match to someone without rejecting pretty quickly. And then, as I mentioned, the wait time can be decreased by having a living donor. And even if you don't necessarily have a direct living donor, there's ways to do microsites and um, have impact on trying to get a living donor, even if you are unable to get a direct family member to be able to match with you.
Okay, thank you so much for walking through the wait list. I also want to talk about can someone fall off the wait list and what are things that they can do to avoid that?
Yeah, so becoming falling off the wait list is very similar to something called being inactive on the wait list. So if you are listed, it's important to keep up with your eligibility. That means that you are keeping up with your testing, sending your PRA kits, which are your antibody kits that are typically, if you're on dialysis, sent to your dialysis center so they could draw it and send it back. But keeping up with all the information that your transplant center needs so that when the call happens, you're ready is really important. You could unfortunately fall off or become inactive on the wait list if for some reason, a cancer is found, or you have a bad infection, or you undergo a major surgery where even if they were to call you, it wouldn't be a good time for you to be operated on or to have immunosuppression on board. So all these things factor in to keep your self healthy and to keep your team updated so that you can stay active on the wait list.
Okay, thank you so much. All right, so you talked about all these variables that go into play when considering someone for transplant. Can you describe the process of matching transplant recipients to kidney donors and what that looks like?
Yeah, great point. So There's a very large UNOS list, and it matches by blood type and cross match, which is any antibodies against other kidneys or other a potential donor. So when an organ offer comes available, it's important to know first that you're nearby and you can answer the phone pretty quickly. Um, but they are mainly looking at blood type compatibility and risk of rejecting an organ if you are matched with that organ. And so those things are called a cross match. And sometimes they will begin the cross match process before giving you a call, so that something called a virtual cross match, so that they are aware of that risk. Once you're notified, though, I guess the ball starts to roll. Right before then, there is a wait list per transplant center, and that allows the transplant center to make sure that the appropriate match is being made and you're in town, so that the transplant could happen for you and the match is possible.
Perfect segue. So I want to think about that day that they get the call. You said be close to your phone. So how long do they have to get to the transplant center, and what does it look like from when they get the call to, going through surgery?
Yeah, this is my favorite part. This is the part that I'm typically involved in. And we find that when a coordinator calls, and our patients always say, I had my phone on, I've been waiting years. They talk about how you just have hours to get there. And so have your bag packed. And once the transplant coordinator gives you a call, it's important to not eat, bring your essentials, bring your medication list. But what to expect, I would say the coordinator calls you and tells you about the organ and tells you what to expect in terms of who the donor is, for the general information that you need to know. Of course, we honor the donor and have to keep their anonymity, but there is aspects that you need to know in terms of risk criteria and infection, and then how much time you have to get in here and to make sure your support person can help you through the process. Once you arrive, you have final blood work that needs to get done, and testing may need to be updated a little bit, especially if anything's happened in the meantime. And then surgery occurs if all checks out. So it can be a really overwhelming process, but the transplant team, including the coordinator when you first get that call, are able to guide you through every step of the way.
Wonderful, wonderful. I just want to do a quick reminder to everyone to send in your questions through the chat. We do have some from the last session that we'll make sure that we get addressed in this. But while we transition, I also wanted to take this opportunity to share one of AKF's resources on kidney transplant. So AKF developed Your Guide to Kidney Transplant, which covers a lot of what we just talked. It talks about everything prior to the transplant. So thinking about, the wait time criteria, all of that. So you can find that in the Docs tab on the right-hand side of the platform that you're looking at right now, and you can download that. All right, so Shazia, let's transition to talking about the transplant surgery and recovery. So what can people expect on the day of their kidney transplant surgery? Who are they going to see? How can they prepare for that?
Yeah, great question. So the surgery typically takes about 3 to 5 hours, and as you come in, all that blood work will be done. Any updates like an EKG, or any other testing that needs to be updated, they'll walk you through the surgical consent and blood consent and have you understand exactly where the kidney is going to go, how many days you are anticipated to stay in the hospital. And I've worked at a few centers, and I know that the hospital stay on average can be about 3 to 5 days. It does vary depending on how things are going, and your team will keep you updated. And so I would say, knowing that you're rushing to come in, you're overwhelmed, know that the surgery is about 3 to 5 hours. Your caregiver can wait in the waiting room, and you'll be able to have an update. They'll be able to have an update about how things are going. So there's lots of aspects in what to expect at the surgery immediate part. During that surgery, the kidney is placed in the lower abdomen, and a catheter is placed in the bladder to be able to monitor the urine output. It's very exciting when we see the urine. There is also a stent that's placed to keep that ureter open and allow flow and protect all the areas that had surgery. And then typically that area is either closed with sutures and glue or staples. And so that will require some aftercare as well. But the Expectations around surgery is typically things start to move really fast, and then you'll have time to kind of absorb and understand what's about to come for a new transplant journey.
It sounds like a very exciting process. I'm sure a lot of the transplant recipients are immensely grateful afterwards. Um, you mentioned about the placement. Can you talk about what happens to the native kidneys or the kidneys people are born with? What happens during the surgery with those?
Yeah, so interestingly, the kidney goes in the front in the pelvis, and the native kidneys stay in the back, and they are not removed. They tend to atrophy or shrivel or become smaller when they don't function. So they are not their normal size, and they don't need to be removed during or after the transplant unless there's an infection to them or there's a problem with your native kidneys.
Okay, great. Will people have a chance to ask questions to their transplant team in the days that follow surgery? So how often will they see them, and who will they see?
Yeah, you'll see a variety of team members. So, as you saw in prior sessions, you'll see a social worker, a dietitian, a nurse practitioner, or a physician assistant, or both. You'll also see physicians that'll be surgeons and kidney specialists, which are called nephrologists. And you'll see each of these team members daily. So rounds usually occur in the morning, reviewing labs, and you'll have an opportunity to ask questions. You'll get an update about how your kidney is doing. You'll learn about when it'll wake up and when it'll be time to take medications. You'll also, of course, see your nurse walking you through the process and eventually be able to have a transplant class prior to discharge so that you can understand and have more opportunity to understand the support that you'll be having throughout the process.
Sounds like there's a lot of, expectation setting that happen in the hospital, and you all, the transplant team does a great job, setting people up. Um, Thinking about asking questions in the days following surgery, we know how important the caregiver role is. So I wanted to ask you, and thinking about people in the audience who are caregivers, how can they, caregivers, best support their loved ones in the days following the surgery?
Oh, the caregivers are so important. So, caregivers help the patient who just experienced surgery to recover from the surgery. Medication reminders are really important. So, some of the medications are twice a day, some are a few more times a day just in the beginning. And there are a lot of medications that eventually some of them will taper down. But it'll also be important since they just had surgery to help them with transportation to clinic, to help watch for symptoms that they might not catch themselves. They may say, "Oh, I'm very tired," but something else may be going on. And to also provide that mental health and emotional support while someone is recovering from surgery, but also adapting to a new quality of life and adjusting to the new organ as well. So caregivers are fully part of the transplant team, and we always want to make sure that a patient has social support so that they can ensure they have someone who's going to speak up for them and advocate for them when it's needed and most important.
Thank you. Now, this question, I feel like, it's variable from person to person, but generally, at what point will transplant recipients feel normal again?
Yeah. It might be a new normal, but you'll see that your energy will improve. And so I would say in the first couple weeks, it'll still be difficult since just having surgery, having a lot of clinic appointments and follow up. But I would say after a couple months, it's a big milestone. You'll know how your kidney is adjusting to your body, but everyone's timeline is essentially different. It's a journey, and you won't just feel a kind of a flip of a switch that things are much better now, but you hopefully will wean off dialysis. And if you were on dialysis and be able to adjust with a new normal of having more energy, better quality of life, learning your medications. And so it does take, I would say, a few months to feel like you're in a routine again.
Great. Thank you. All right, adjusting to some post-transplant living questions. There was a question that came in through the audience in the last session. I'm currently on the transplant list for the first time and worried because I keep hearing people have to have more than one kidney transplant. How do I keep that from happening? So thinking about how to keep that new kidney healthy.
Yeah, keeping your kidney healthy is really important by taking your medications as they are prescribed. It's important to stay hydrated and ensure that you're watching your urine output. So any change in urine output could be dehydration, it could be infection, it could even be rejection. So watching the urine output is very, very key. We want to make sure that you avoid infection so that we can increase the longevity of the kidney function and making sure watching routine labs. So in the beginning, you'll have labs twice a week, and that'll look at creatinine and potassium and make sure that your body is able to control the electrolytes. And then managing blood pressure to make sure that blood pressure and diabetes are not affecting the new kidney. But these are all daily habits that are going to help you protect your kidney. I would say there are other things to be mindful of. So making sure you stay in touch with your kidney transplant team. You'll have a coordinator, a nurse, and a nephrologist, or an NP and PA that are well connected to your nephrologist as your nephrology team. And it'll be important to let them know if you run into any challenges. So if you have any signs such as pain in your belly, low urine output, these are the things that you should report. And that'll help increase the chance of keeping your kidney longer and keeping your kidney healthy.
It seems like communication with the transplant team is so important in those few months following. I'm sure, for the long term as well, but especially those first few months. Thinking about those first few months, how often will transplant recipients return to the transplant center post-transplant, and what does that look like?
Yeah, the follow-up is very, very close. So first, it'll be very frequent. It'll be twice a week, and then it'll be once a week, and then eventually once a month. And so the lab aspects are very important, but also the nephrologist talking to you about how you're feeling, how much urine you're making. And eventually, once you are a few months out, every 3 to 6 months long term. So the follow-up frequency in the beginning is very, very close.
You've mentioned urine output a few times. Can you talk about the difference in water intake for people who were on dialysis before to transplant recipients, how much water that they have to drink and what that urine output expectation is?
Yeah, great question because it's a little bit different for everyone. I would say that water intake generally is able to increase once you're off dialysis. So sometimes when someone gets a kidney transplant, they may not be weaned off dialysis immediately if the kidney hasn't woken up. But I know that intake is decreased or should be decreased while on dialysis, especially since the kidneys are not working. Now, in terms of transplant, as soon as off of dialysis and you see your urine output increasing, your nephrologist will tell you that you'd be able to start increasing the water intake and the fluid intake. So you might even be able to go up to 2, sometimes 3 liters. But the more you drink, the more you'll pee. But we also have to make sure there's other aspects. You're watching your swelling, you're watching to see how your heart feels, how your breathing is, and all of those things can help you understand how well you're tolerating the amount of water and keep your nephrologist informed too to see if they'll be able to give you an exact number of how much water you can drink.
Great, thank you. We were talking a little bit before about immunosuppressants or anti-rejection medicines. I want to come back to that. And I will just note for those of you who didn't watch our previous session, there was a transplant pharmacist who was speaking in that one. So if you didn't get a chance, I recommend going and watching that recording because he talked about, that role and a little bit more about the medicines. Shazia, managing multiple new anti-rejection medicines, it seems like it could be overwhelming. You were talking about how important they are. It's a lot at first. Will the transplant team support them with this? And, thinking about the side effects, what if there are a lot of side effects? Are there changes that can be made?
Yes, great question. So keeping track of your medications is very important. Never running out of them is even more important. Not missing doses is incredibly necessary. So I would say that yes, the team is able to help you through. There are transplant pharmacists, as we heard about earlier, and coordinators who can help keep you organized. Some clinics, transplant centers have pill clubs so that they can help you organize your um, pills into a medication organizer and keep track of them better. With keeping track of them, it's important to look at the side effects, as you mentioned. You don't ever want to stop the medications on your own to see what's causing something. So it's important to talk about what you're feeling. The most common side effects that patients report and that are studied include tremors. So one of the main medications that transplant patients take is medication that can cause tremors if the level's too high. And that's really important to watch out for because that's a clue that you'll need labs again to see how your level is and to make sure that it's not affecting any other part of your body beyond the tremors, including affecting your kidney function. And so some medications like steroids might cause weight gain or high blood pressure or change your blood sugar. And the side effects are common, but it's important to keep in touch with your team, the transplant pharmacist and the nephrology team, so that they're aware of anything that could be affecting you that could be adjusted in terms of a different medication or a different dosage so that it doesn't affect your body in different ways.
Great, thank you. All right, so I want to talk about kind of long term. And can we start in the last session? Actually, there was a question that came in about how we've heard that getting a transplant can increase the risk of getting certain cancers. How common is this risk?
Yeah, great point. So, cancer risk can happen. This is why the maintenance health is very important. So, getting a colonoscopy, getting skin screenings. So, with your dermatologist yearly, there's a particular medication that we keep close eye on and ensure that patients, when they're on it, is a very common immunosuppression or anti-rejection medication that people who have received a transplant need to wear sunscreen to reduce their risk of skin cancer, which is very common. Keep an eye on your skin. Always make sure that you're getting your annual skin screening and skin checks, getting a colonoscopy when you're due, looking out for signs, more fatigue or weight loss. And it is common but preventable. So important to keep an eye on, talk to your nephrology team about keeping up with your health maintenance.
Thank you. I want to go a little bit more broadly now. So we talked about specifically cancer. Can you just walk us back and talk about what are some of the other challenges that transplant recipients could experience post-transplant?
Yeah, great question. So, challenges with transplant and immunosuppression in particular are infection risk. The risk is the highest in the beginning. And so that is mainly because of the immunosuppression being very strong in the beginning and then being on maintenance after. So those are maintenance doses. But viruses and bacterial infections are very common, so are fungal. And so the team will put you on prophylaxis medication for a certain amount of time based on what research and studies and risk have shown. And some of those are Epstein-Barr virus or CMV or cytomegalovirus. And those can be monitored through lab work. So screening through, depending on the risk of the recipient, or the person who receives the kidney, and the donor risk. So we would know what someone's risk is. Is it high, low, or moderate risk? And so these are all important in terms of regular transplant-related infections, but also very relevant to our respiratory season. So flu, making sure that you have your flu shot, your COVID shot, that you're immunized against other viruses and illnesses so that you can protect yourself. But just as soon as you get a transplant doesn't mean you should go get vaccinated. The vaccine should happen in a timely manner so that your body can take to them, especially since you'll be on immunosuppression immediately. The other aspects and challenges include medication side effects, as we just covered. And then there's also a emotional adjustment. So you are now receiving a donor organ. They have given you the gift of life. And I think beyond that, you're also weaning off of dialysis, which I know can be a very tight-knit community. You're seeing your dialysis team and those who are doing dialysis alongside you, but that doesn't mean that you lose touch with them. It's important that you talk to them about your experience and kind of build so that as we have advocates and people in our community who talk about how transplant has been for them, that can also help you through your process of the emotional aspects of post-transplant and a new adjustment and a new lifestyle. And then I would say financial stress. Sometimes our insurance can be affected, sometimes work can be affected, but it's important to keep your team in the loop. There's also psychologists that are part of the transplant team, and they can work with you to help you go through the mental health aspects to support you as well.
Thank you so much for covering all that. I feel like you did a comprehensive answer to my question. I want to think about kidney rejection. So, what are some signs? And I guess you had mentioned some of the tests for the infections. There are tests that are also happening in the follow-up visits around kidney function as well, and looking for rejection. So, I want to talk about ask you, what are those tests, and can you talk about what they can expect? And then what are also some signs and symptoms they could look for that kidney rejection is happening?
Yeah. So I'll start with signs and symptoms. So sometimes there's no symptoms and it's just found in labs. So the testing is very important in terms of looking at the creatinine. I know pre-transplant we talk a lot about eGFR, but we very much tightly look at the creatinine. Did it go up? Did it go down? Is it stabilized? Has it moved? And that's something you can always ask post-transplant about how it's doing. Hopefully you have access to your portal, and that can also once you get your labs done and within a few hours, sometimes they'll pop up and your team will call you about them. But sometimes there will be symptoms. So a fever, urine output can decrease. There could be swelling, which means that you're not peeing out the urine through the kidney, being able to filter it. Sometimes you'll gain weight, be short of breath, or even have pain in the front of your abdomen where the kidney was placed. And those can all be signs of rejection. In terms of testing and depending on what the disease process was prior to transplant, I would say, especially if protein was being monitored in the urine prior to transplant, especially with FSGS or other disease processes, this will be monitored after transplant too. So if there's protein spilling into the urine, your team will pay attention to that, and you can always ask about that as well. But creatinine, protein in the urine, and symptoms that I just kind of reviewed a little bit, those lab tests are very important. Some centers will have protocols depending on how the cross match was and the risk of rejection that you could get cell-free DNA done. And that'll help determine if you are having like a silent rejection going on in the background, depending especially what your antibody levels were and your risk of rejection at the time of transplant.
And if someone goes in rejection, what happens? Do they go back on the wait list right away? Are there ways to treat that? What happens next?
Yeah, great question. So, often rejection is treatable, more often than not, and usually steroids are used in the beginning of when we catch rejection occurring, and other therapies can be used as well. So these therapies can help further reduce the immune system being overactive or attacking the kidney, so that it doesn't reject or continue to reject. And occasionally, depending on the situation, again, cell-free DNA is very important, and so is biopsy. These can determine what type of rejection to be able to determine the type of treatment. And not all the time does kidney function fail or the kidney fail itself. But if that were to happen because the rejection is so severe, and very serious. Yes, depending on the cause and depending on what led up to it, you could be reevaluated for listing for a transplant. You most likely have to go through the process again to ensure that you could undergo surgery, what your antibody levels are. But knowing that it's very important to keep up with your medications, not miss doses, your body can still be at risk for rejection, depending on how your levels are and how your body takes to the kidney. So I would say rejection is serious, but it's most often manageable.
Okay, thank you so much. One other question I want to make sure we address. Again, this came in from our last session. What if after 2 years post-transplant, you lost your second insurance and they won't pay for one of your transplant medications?
Yes, so if this is the case, it's important to touch base with your transplant social worker and the financial department of the transplant institution. So they would want to ensure that they give you the resources, including any advocacy fund or any advocacy groups that have support for transplant patients can help. And there are pharmaceutical companies that have programs that help reduce the cost, like a patient assistance program. And so it's important to touch base with a social worker and do a quick search to see if there are systems like that. If you're having an emergency and it's a short period, you can go to your pharmacy and ask them for an emergency bridge of medications they could supply to you, but immediately let your transplant center know.
Thank you. One more question on medications. I think you kind of touched on this in the beginning, but want to make sure this is clear. How long will you stay on medication? Is it for, a short period of time? How long do you?
Yeah, I would say the life of the kidney. And so, like I mentioned, deceased donor kidney transplants are about 10 to 15 years of longevity. And then I would say living donor is about 15 to 20 years. But for the life of the kidney and beyond, so if the kidney's still in there but not working, it's still foreign. So I always say that it's important to stay on the medications for life and anticipate that you'll be on the medications for life.
Thank you. And I also wanted to mention that American Kidney Fund did create another educational resource, your guide to life after kidney transplant, which is also accessible in that docs tab on the right of your screen. I want to pivot to talk about living donation. So we know how in demand it is. I want to talk about some of the living donation options and some practical questions for someone considering it. So, what are the different living donation options? I think you kind of were mentioning in the beginning, if you don't have someone can you just walk us through a few of the different options?
Yep. So it could be a family or friend, if you're compatible with them, and if they are eligible for surgery, which is great. If for some reason they're not compatible with you, which sometimes does happen, you don't have to find the perfect match because there are paired exchange programs. And that essentially means that someone will donate on your behalf, and they will find a chain to be able to place that kidney and find a match for you as well. And that kind of delves into something called a voucher program, where someone can donate when they are ready on your behalf. And then as soon as an organ becomes available that matches with you, you would get an organ and it would be a living donor. And so that wait time is much smaller, as I mentioned before. Sometimes there might even be an altruistic donor as part of that chain, which would be really nice. You don't know them, but they are donating to support that chain of donation and recipients. This kind of has expanded the possibility of donation and expanded living donation. But generally, I would say those options are for living donor. Many people create microsites so that they can say that they are looking for an organ, a particular blood type, and they're looking for a match. And there are donors out there, sorry, recipients do that. And there are a lot of donors out there who are looking for someone to donate an organ to and to help. So microsites, in the sense of creating a page like that and informing people that you are looking can be very helpful.
Thank you so much for going over all of those. Again, thinking about the living donor experience, how long will someone who is donating a kidney, how long will they have to take off of work?
Yeah, I would say about 6 weeks. And so that's a typical time period that someone might have to take off of work. There are living donor assistance funds, such as the one at AKF, and other funds to help a donor kind of with the travel expenses, the wages, the evaluation process. And most donors go on to be able to go back to work after that 6 week period. It is surgery, but now that they are done robotically and laparoscopically, donors can go on to live healthy lives with one kidney and go back to work at that point.
Thank you. Thank you so much for covering living donation. I want to take the chance to think about the future of kidney transplant. So, in an earlier session, Dr. Urim talked about the disparities around kidney transplant and discussed it's not easily accessible for all. So, I want to think about the change around kidney transplant, the change in this area. Can you talk about the future of kidney transplant? So, yeah, what does the future look like? And, what's some research being done?
Yeah, now there is research on organ preservation. So if an organ is coming in though and they need to pump it or keep it on, instead of keeping it on ice, there is something called normothermic perfusion, where they can keep that organ perfused a little bit better and differently than we have in the past. And this helps prevent from the cells from either dying or needing longer to wake up, which has been really promising. The other is animal to human research. So that's something that we know as xenotransplantation. And that's still in the works in terms of being researched and trialed. We hear about on the news the way that the trials are being adjusted depending on their findings. So that's kind of what the future looks like. But there's also some matching algorithms that are in the works and expansion of living donor programs and opportunities so that we can all help with wait times. But it's going to take time so that we know what works and how it can best help patients.
Absolutely. Uh, I also want to think about innovations or advancements around these medicines. So, as we talked about, there are side effects. There is pill burden where, there is a lot to take and manage every day. Can you talk about advancements around anti-rejection medicines?
Yeah, there's actually a great study that was recently done by the Transplant Societies in looking at the side effects of these immunosuppression medications. They haven't changed in a long time. They are working well to prevent rejection, but the patient impact is great in terms of how the tremors and different aspects of their life might be affected by the side effects of the medication. So I would say that there's research ongoing too about cell-based therapies, about bone marrow transplants associated with immunosuppression at that same time. Immune tolerance protocols are happening at the same time so that we can get better targeted medications eventually. And so the science is definitely moving forward in this, and we're looking at the right things, I think, knowing that we need to target how someone tolerates their medication, how their side effects are. And so I look forward to what the next couple of years bring with being on lifelong immunosuppression, being able to wean off of it eventually. Of course, making sure that your nephrology team is continuing to monitor, but we're not there yet, but I believe we will be.
Really exciting to think about the future. We do have some more questions that are coming in. I do want to be mindful of time, so I'm going to choose one that hopefully we can wrap up in a few minutes. So, with kidney disease, are both of the kidneys impacted, or is it just one?
No, that's a great question. So it depends on the kidney disease. Sometimes there might be an anatomy problem with one of them, or it could be both of them. But typically, the disease, especially if it's immune related, can impact both kidneys. And you may not know that you have kidney disease unless the function fully goes down because the EGFR will be affected or the estimated glomerular filtration rate, which is how we know if the kidneys are able to filter. But sometimes there's on occasion, one kidney may not be working, but the other one picks up for its function.
Wonderful. Thank you so much. And this is concluding our Q&A for today. So thank you, Shazia, for answering all of our questions. And thank you, everyone, for joining us. If you didn't get your questions answered, please visit kidneyfund.org to check out our transplant educational resources. That wraps up today's day 3 of Kidney Action Week. Please tune in tomorrow for our last day of Kidney Action Week, which features a lineup of exciting topics around what's new in kidney care. Our first session of the day is the policy briefing, policy and innovation in kidney care at 11 a.m. Eastern Time. As we wrap up this session, you will see a brief survey pop up. Please take a few minutes to fill it out and tell us how we did. Your feedback will be very useful as we plan future events. Thank you, everyone, and have a great day.